Doctor comes in and starts asking me questions. So they take some blood and they come in and tell me they're going to have to do a spinal tap. They had to culture it to determine if it was bacterial or viral.
Minutes count. So if you suspect you may have something worse than the flu, it could be meningitis. Take yourself, your friend, or your child to the doctor right away. Early diagnosis and treatment are very important. The treatment for meningococcal meningitis is antibiotics, which must be administered immediately to be effective. Earlier, I mentioned that about 2 in 10 survivors can suffer permanent disabilities or disfigurements, which can include amputation of fingers and toes, or arms and legs, brain damage, learning difficulties, deafness, blindness, kidney failure, and paralysis. These can range from the very mild to the extremely severe.
Johnny was diagnosed with septic shock and meningitis in January of 2000. Time has been a big healing method, coping. Jonathan is cared for by me. I've retired from my job to watch him, and I have a new approach to life that's helped out. I mean, I care for him. My primary goal is to make him as comfortable and happy and healthy as possible. And I think he has outlived his lifespan by 4 years now that they gave him. He has a great crowd of friends that are with him every day. Haven't been deterred by such extreme disabilities where we've been isolated. Obviously, he's not developing like most of us, but I've grown to accept that.
So how do you lower your chances of getting meningitis? Ask yourself, should I share my soda? Is taking a bite of food off my friend's fork really that smart? Is trying out my friend's lip gloss worth the risk? The easy answer is limit your exposure to other people's saliva and mucus.
If someone suspects that they have been in close contact with someone who possibly demonstrates symptoms related to meningococcal meningitis, they need to seek treatment immediately. And treatment is usually prophylactic to prevent the disease. But since it is a stealth disease, and since death can occur rather rapidly once the symptoms occur, it's extremely important that those who believe they've been in contact with someone with meningitis seek medical attention immediately, without delay.
As we learned earlier, we know the meningitis germ can be found in the smallest drop of saliva that can find its way to the top of a soda can or the prongs of a fork.
The teenage group and the college students are the ones we really and truly need to make sure that they are vaccinated against the disease, because they're the ones who are the most susceptible.
There are vaccines available that can vastly reduce your risks of contracting meningitis.
The vaccine only covers about 85% of 4 types or 4 strains of the meningitis bacteria. But in an environment where this disease can be quite deadly, 85% is actually pretty good against 4 strains of the bacteria.
The way most vaccines work, including this one, is by helping your body create antibodies against the bacteria that causes the disease.
If Mary Jo had known the symptoms, she probably would have sought help earlier, and that could have saved her life.
Meningitis means a lot more to me now.
It's something that may completely change your life.
It's truly the most traumatic thing that I imagine anybody would ever have to go through, is the loss of a child.
The next person that it happens to, and it will, they'll be 1 out of 1. And in their family, that's 100%.
I was holding my son's hand when his heartbeat beat for the last time.
It's very sad to lose the ones we've lost, but we have to learn from their loss. The awareness is the biggest thing.
You can do something to help by making yourself aware. You can save one's life.
We hope this video has provided you with information to help keep yourself safe. Remember, awareness is key to prevention.
Learn more about meningococcal meningitis and available vaccinations. Visit the MAK website at www.makinfo.org or call your local healthcare provider.